Before entering the home of a client with active tuberculosis or TB, take airborne precautions by wearing an N95 mask. Wash your hands often and encourage your client to as well. Wash with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer. Wear gloves to avoid coming into contact with infected garments and/or items. Clients with active TB should be isolated until they are no longer contagious, usually for the first 2 to 4 weeks of treatment.
They should not share common airspace with non-household members when he is no longer contagious and can resume normal activities outside of isolation while taking medication.
Come in.
Good morning, Pete. How are you today? Hello, Monica. I'm feeling much better. Monica notices that Pete isn't wearing a mask. That's great to hear. Have you finished that mystery you were reading? Excuse me. Have you finished that mystery you were reading? Excuse me. Yeah, it's getting pretty suspenseful. Encourage respiratory hygiene and cough etiquette. If able, clients with active TB should wear a surgical or a cloth mask when in the same space as you. This helps prevent the release of TB germs into the environment. When home and feeling a sneeze or cough coming on, clients should remove their mask, then cover their mouth and nose with a tissue. The tissue should be disposed of properly. Coughing or sneezing into the mask could saturate it with more germs, ultimately increasing risk of direct exposure to active TB. If in public, the client should cough into their mask with a tissue. Here's some hand sanitizer and a clean mask. Oh, oops, I forgot about that. Thank you. Do you mind if I open the window up for some fresh air? Go ahead. It's nice to see the sun shining today. Because TB is spread easily through the air, you have to isolate. I want to help you get out of isolation as soon as possible. Can we work toward that together?
Expressing empathy acknowledges and validates your client's feelings. This encourages an environment where they feel comfortable openly expressing their concerns and frustration. This also fosters positive communication between you and your client. If your client skips a dose of medication, encourage them to report it to their doctor. Always have your client take all the medication their doctor prescribes. You can help your client maintain their drug regimen by setting reminders, leaving notes, or helping them keep a written record. Watch for possible adverse drug reactions, including this list.
If your client experiences any of these, notify your supervisor immediately. TB treatment can take a long time. Clients may feel angry or frustrated. Encourage them to stay in touch with friends and family. It's also beneficial for them to continue enjoying activities that they can participate in safely. Notify your supervisor if you're concerned about how your client is coping with the disease.